Hi, I'm Jennifer Harrison. I'm an associate professor and the interim director of Western Michigan University's School of Social Work, as well as a licensed master social worker and a certified advanced alcohol and drug counselor. And I want to talk to you today a little bit about co-occurring mental illness and substance use disorders and their prevalence, as well as the outcomes associated. The National Survey of Drug Use and Health estimates that approximately 40 million Americans have a mental illness each year, as well as 22 million Americans have a substance use disorder each year. There are about 8.2 million Americans that have both a mental illness and a co-occurring substance use disorder at any given time in the US. Co-occurring disorders are more common in people with serious mental illness, as well as with serious substance use disorders. This is part of the problem. So if you have a serious mental illness like schizophrenia, bipolar disorder, major depressive disorder, or another psychotic disorder, your risk of having a co-occurring substance use disorder at some point during your life are over 50%. This is compared to the general population, which has a lifetime co-prevalency rate of approximately 16%. So co-occurring disorders are relatively common. The trick to this is that outcomes for people with co-occurring disorders are also worse than for people with a single disorder. These are in important areas that we all care about, like incarceration, hospitalization, unemployment, homelessness, and healthcare. And the third component is that people with co-occurring disorders have lower rates of treatment engagement than people with single disorders. One of the things that we used to do is to make people with co-occurring disorders come to treatment at 2 separate locations, or in what we called sequential treatment, where you got your mental illness taken care of first, and then your substance use disorder taken care of. Or you went one place in town to get your substance use disorder treatment, and then a totally another place to get your mental health treatment taken care of. Either sequential or parallel treatment are less effective than fully integrated care, which means essentially that you have the same team of people, of interprofessional healthcare providers, working at the same time with the same plan to help you with both chronic diseases. One of the things that I want to talk about is the importance of the treatment, the ongoing treatment of co-occurring disorders by a variety of health and human services professionals during our current pandemic. So it's critical, not only in primary healthcare, but also in specialty healthcare for the treatment of people with substance use disorders, mental health conditions, as well as co-occurring disorders, to receive treatment by a wide variety of healthcare heroes, including social workers, chemical addictions counselors, nurses, physicians, physician's assistants, speech and language pathologists, occupational therapists, physical therapists, respiratory therapists, and the like. Unfortunately, having either a serious mental illness or a substance use disorder does not protect anyone from having other chronic or acute health conditions. As a matter of fact, it puts people at higher risk of having those conditions due to a lack of access, a lack of appropriate healthcare insurance, and some of the side effects of some of the treatments of substance use and serious mental illness. So one of the things that I'd like you to hear is the importance of the treatment in an integrated way of co-occurring substance use disorders and mental illness, and the importance of all of the providers that are providing care for those individuals who need and deserve our best evidence-based treatment. Thanks so much and have a great day.